Today, Tiffany and I will be talking about how we've started on our journey to streamline the provision of patient information across the Shoalhaven and Illawarra Cancer Care Centres with the help of our patients and carers. I'd just like to acknowledge the rest of our project team as well. So just a bit of background. A number of surveys were conducted and all indicated there was work to be done on the provision of patient information across the two centres. With the establishment of the Essentials of Care program in our department, we were empowered to engage our staff and patients. Through theming of data collected from the program, it was noted that although there are areas to celebrate at our centres, it was noted that there was considerations to be looked at in regards to the provision of patient information. Key areas to improve were the amount of information we were giving, who was giving the information, the timing in which it was being given, where we were giving the information, and the inconsistency of advice given by staff across disciplines throughout the radiation therapy process. Whilst attending the Health Literacy Ambassador course run by the hospital, it was stated that 60% of consumers with English as their main language have a health literacy level equivalent to a 12 to 14-year-old. It was encouraged that all written information currently being given to patients should be assessed for readability at this level. It was also noted by staff who worked across the two centres that the information we were handing out varied depending on the staff giving it out, and that all patients at one centre received information that was not being given at the other. What do we do with this information we have collected, and where do we start? So this is basically what my brain looked like, trying to piece together key areas from the data we had already collected. We need to try and figure out what we should start with, as there seemed to be a lot of things we needed to look into. Stepping back, it seemed that if we could get our written information right, there should be a flow on to other areas, improving consistency and advice across all staff members, and also provide a basis for our patient education sessions. It was clear that there were some areas that we, the staff, could look at to improve our information, but most importantly, we needed our patients to tell us what they want. I realised that up until now, we had not focused on the needs of those that come through our doors each day, but had developed an ad hoc process of giving information on what we, the staff, thought our patients needed. I know I've not been through this journey, so I really do not have any idea of what they really need. So from a staff perspective, we could see there were so many benefits in completing a quality improvement project in this area. Keywords were popping out at us: consistency, engagement, knowledge, confidence, the right amount at the right time. The most exciting part of this project would be that our patients and their carers will be the ones to help us find a way forward and shape the provision of information across our radiation oncology departments how they would like it. So a project group was formed with staff from the Illawarra and Shoalhaven centres and included all disciplines involved in providing patients with information during their journey. The group included a radiation oncologist, radiation therapist, and radiotherapy nursing staff. The aim of this initial project was decided: to improve and streamline radiation oncology patient written information. The group put together objectives for the project. Key to this was to understand what we are doing now, as this really was not clear, particularly between our two centres, which are an hour apart.
So in order to put Belinda's brain or her mind map into reality, as a group we wanted to make sure that we approach this in a methodical way so that any changes we make actually are based on what the patient wants, both using qualitative and quantitative techniques. As the image shows here, we made sure we had all of our ducks in a row with engaging with our sponsorship from our executive team. We had initially set a time frame of 4 months. We knew that we needed to double it, and then we still went over just by a couple of weeks as well, as we know it's hard to find a balance between providing the clinical care to our patients and working on quality improvement projects. There was no need to reinvent the wheel and create a new survey, as the Satisfaction with Cancer Information profile from the UK covered an array of items that we set out to review, and it used Likert scales. We conducted the surveys by using both paper and electronic formats. We had the survey on an iPad, which helped us with the data extraction. The patient was given the option to complete it by themselves or the radiation therapist could take them through it prior to their treatment session. We then slightly adapted the same survey so that we could use it on staff. The idea was to gain staff perspectives and compare them to the patient and to see if it aligned. We then planned to reuse the same survey in 12 months' time to see if any changes that we do make, to see if they actually have improved. Discussions between staff and patients occur daily, with many potential suggestions for change and improvements going unrecorded and undocumented. So this was one of our first times that we had structured qualitative interviews in the radiotherapy department. We found that conducting these interviews was so extremely valuable, as we were really able to delve deeper compared to the survey into actually what the patient really wants. One of the highlights was from a carer themselves, where they stated their loved one was not overly interested in the written information, but from a carer perspective, it was integral for them to know where the parking is and to know what to expect of any toxicity and side effects for when their loved one comes home. Belinda and I conducted the interviews across both sites and conducted a thematic analysis on the transcripts. Conducting an inventory of all of the documents handed out to the patients was not an easy task. First, we needed to map out for each of the tumour streams the patient journey and approach staff at each point to gather the written information. We used post-it notes and my office wall was definitely covered. It became evident early on that there was a lot of duplication of written information being given to patients, and also that some patients were missing information, and also some irrelevant information was being given to patients for what their cancer was. Here is a folder of the pieces of patient information that was handed out to breast patients. There's over 20 pieces of paper in here and booklets and information that could easily get lost along the way. This folder was then given to nurse consultants and radiation therapists so that they could provide a structured review on every single piece of document that was provided to the patient. Once we had collated the results from the surveys, the interviews and the inventory, we arranged a workshop so we could plan and establish our recommendations based on the data. This was a full-day workshop with all disciplines. We also involved the Cancer Council representatives as well, and we had patients who came along to contribute on the day. From this, we developed short, medium, and long-term recommendations that Belinda will enlighten you on soon. How far did we reach? As you can see on this slide, we had a rather good representation of respondents from different staff disciplines and tumour groups. Sample size is always challenging. However, based on previous projects, we were satisfied with these numbers. Going into this, we as staff had our own ideas, such as put all written information on a USB, it'll solve all of the problems, or hold a group education session with questions and answers. But as it turns out, this was not what the patient wants. Although this project was about written information, it is only natural that it would have a connection with verbal communication. One of the most interesting points which we came across, as you can see above, is that patients were most dissatisfied with the amount of verbal communication they received. Conversely to this, the item that staff were most satisfied with was the amount of verbal information that they provided to their patient. So here we can already see a disconnect. We found that the timing in which written information was given differed between each site of the Illawarra and the Shoalhaven. At one site, it was given rather late and not providing enough time for the patient and carers to digest and prepare questions. When a patient enters the system, they at times become overwhelmed with the atmosphere, the information, amongst their many appointments. A theme that arose was patients not really knowing and understanding the pathway, with some suggestions of a flow chart to be created. This could be a simple diagram showing the stages of clinic, and then 2 weeks to planning, and then 2 weeks to treatment, but individualised for that specific patient, and then how many days or weeks of treatment for them, followed by their 6-week follow-up appointment. Throughout conducting this project, it became apparent that there were too many individual pieces of paper being handed out. As I said earlier, we went into this thinking a USB would be the answer. But secondary to verbal information, paper is still the preferred method, followed by video resources and then reputable websites. The environment was also very important to the patients, and this is definitely an area that we need to improve, specifically for one of our centres. We also found that the older the patient gets, the less information they want, which this aligns with literature. However, their carers still need this information. Two other areas we found was that patients would like more information on quality of life, and that the majority of the documents were actually well and above the literacy level. As soon as you put the word radiotherapy or oncology into a document, it already increases the document's literacy level.
So the results from the data that we collected, along with the recommendations from the workshop, we sorted into quick wins, short, medium and long-term goals, as can be seen in this slide. We could see that new project groups were needed to be formed to work on specific areas identified, so we could concurrently work through these recommendations. Those groups being for a tumour site-specific booklet development, a group to work on patient resources to accompany the booklet, and verbal communication. I've broken down some of the recommendations over the next couple of slides. Some of these recommendations will reiterate the results that Tiffany has already given you, but lets you know the areas that are at the forefront of what we are working on now in our departments. So we had a great discussion at the end of the multidisciplinary workshop as to how we could head forward to be able to incorporate the data collected on our current written information. So someone yelled out that we needed a booklet, that way the information won't get lost. Another person said that we should make the booklet tumour site specific, so patients don't have to sort through generic information to be able to find the process and side effects of what they are actually going to go through. And photos within the booklet can also be relevant for the equipment that they will have made for them and relevant to our departments. We suggested tabulated sections could be used within the booklet so the information doesn't look to be in one large chunk. This could also give the option for the patient to only read relevant sections for their point in their journey, or the option to read everything. The 21 out of 31 documents not at the correct literacy level was a little alarming, but by redeveloping our information, we'll be able to ensure the booklet is written at the appropriate level and in plain English. We'll also be able to utilise our patient information portal resources through the Illawarra Shoalhaven Local Health District intranet. Part of the steps to having documents approved by the patient information portal also includes the use of a consumer review process during the development of patient resources. We now understand that everyone's information needs are different due to many different reasons, with age being identified as one of these differences. And while conducting the patient interviews, this was noted. Some patients wanted lots of information, some wanted none, some read everything they were given and beyond, and some read nothing, and were happy to leave their care in the hands of those who knew what they were doing. For these reasons, a standard minimum amount of information needs to be given to every patient. The information can then be customised to each individual's needs by using reputable resources such as the Cancer Council. These extra needs may be to do with working, talking to your children about cancer, or statistics about their particular cancer. And there are great resources already out there that do not need to be reinvented. We found from our interviews that our patients just wanted to know where to find this extra information and what reputable resources they should search to find the information they needed without searching through Google results. So what about who will give out the booklet and when? Suggestion from the workshop was at clinic. Patients had commented that they wanted information before the procedure so that they would know what questions to ask. They also stated that any information given to them needs to be verbally reiterated at each step to check for understanding. This one and only point of handing out all written information about the journey should also mean that all patients will actually receive all relevant information for their radiotherapy treatment. During interviews with the patients, some said that they didn't actually get any written information at all from our centre. Developing our own in-house information is important. Even though there are many other similar documents available through the internet, every department has their own equipment and procedures for the radiotherapy process. By developing our own written information, This can all be incorporated and will hopefully provide some familiarity to the patient as they go through their steps. Okay. So even though our project was to review written information, from the data we collected, it was indicated that verbal is the most important mode of communication, with written just being a backup when the patients and carers are at home. Therefore, it is imperative that our staff is trained to be able to deliver information effectively and listen effectively, to be able to make sure that the patient and carer is understanding what we are telling them. It was also said the environment in which we're giving our written and verbal information is very important. A quiet and comfortable place where they feel secure enough to be able to have any difficult conversations and to be able to ask questions. Okay, I've got a red sign. So in conclusion, it is really important to identify what the patient wants. So it was noted that there was difference between staff and patients and what we thought they wanted. Just the last thing. So the great thing I've got from this project is data from our patients, because now as we travel along and we're creating these booklets and resources, as staff members say to me, but I think we should be doing this, now we can always go back to that that's not what the patient wants. So thank you.